All of this comes at a time when Americans are already struggling to afford the basic needs: gas, groceries, healthcare, housing. So Democrats stand willing to work in a bipartisan way, but we aren't going to work with them when they go down the partisan path alone. I'm grateful to be joined by Congressman Ami Bera and Congresswoman Maxine Dexter, both distinguished doctors, joining me and Vice Chair Lieu up here today. We're here today because Donald Trump and House Republicans have created a full-blown healthcare crisis in this country. Since Republicans passed their big ugly law, we've been hearing from our constituents nonstop. They are scared that they'll lose their health care and that their local hospitals will close and that they'll see their insurance premiums continue to rise. All of this comes at a time when Americans are already struggling to afford the basic needs: gas, groceries, healthcare, housing. On Friday, we saw just how harmful Donald Trump and his policies are for the American people. The latest jobs report showed a significant slowdown, with just 22,000 jobs added and unemployment reaching 4.3%, the highest rate since the pandemic in 2021. The amount of damage that this administration has done to our nation in 9 months is staggering. There is no doubt that because of his cruel and chaotic administration, the costs of the American people are rising and American families are worse off. Meanwhile, House Democrats are doing everything we can to protect Americans' access to affordable, quality health care. We implore Republicans to abandon their partisan go-it-alone approach and work with us on legislation that improves health care for our constituents in red, blue, and purple districts. It's time for Republicans to get serious about supporting the hardworking individuals they represent, rather than the ultra-wealthy and well-connected elites that they continue to defend. Nick. Sorry. Nick. Is your name Nick too? Nick, please.
I'm going to ask you on the ACA.
Nick, please.
I want to ask about government funding. Do you see this government funding deadline at the end of the month as being a fight over the ACA credits?
We see this being a fight over values. We see this being a fight over the Republican assault on healthcare. We know that the Affordable Care Act, whatever we want to say, Nick, Medicaid, Medicare, the Affordable Care Act, all of these, the American public views through a positive lens, because the American public gets their health care from these important programs. That's what we're fighting about. But this isn't just about the Republican big ugly bill and the big ugly law now, and that attack on healthcare, which is now law. This is still happening today in the Appropriations Committee, where I'll go back to after this press conference. The continued attack and assault on healthcare, on NIH, on research, on infant mortality programs. All of these things matter to our communities. So this is much broader than the Affordable Care Act, although we lift that bill up for all of its positive achievements. This is about fundamentally Americans who receive their health care are now under attack by the Republican big ugly law and the continued attack in the Appropriations Committee. Even at this moment, at this day, at this hour, healthcare is under attack by Republicans and Donald Trump. We can't stand for that. We're not going to take that. And so you're going to continue to hear us speak up on this from now until the end of the month, with a potential Republican shutdown. Danielle?
Tying to what Nick asked you, is there a scenario where Democrats don't compromise with Republicans on a CR, which it seems like that's what y'all are coalescing around because of this fight?
We will work in a bipartisan way with our colleagues on legislation that meets the needs of the American public. That's what we want. If Republicans are willing to meet us, then we will do that. But what they have done, all we can do is judge them by where they've been. And where they have been is focusing strictly on partisan bills that assault healthcare. And so it's kind of hard to flip the page and to say, oh, okay, now we trust you because you want to have a conversation. After everything that they've done this year and even through today is an attack on healthcare in a partisan way. So that's why we'll be incredibly, cautious as we proceed. But that's the importance of this moment and what doctors like Maxine Dexter and Ami Bera and their rich experience bring to the table in advocating for patients in the past. That is who they are. That is the values that they bring to the table and why their voice is so critical at this point. You have heard the vice chair and I continue to talk about this, but it's so incredibly important because the chaos machine and this potential Republican shutdown is harmful. But the American people are the ones that will suffer. And so Democrats stand willing to work in a bipartisan way, but we aren't going to work with them when they go down the partisan path alone and assault healthcare.
I'm just want a quick reaction to the bill from 10 Republicans to extend the ACA tax credit, number one, and number two, the bill, the big, ugly, beautiful bill, whatever you want to call it, has a pay-go sequestration of $500 billion for Medicare. In past years, the parties have worked together. They simply waived those pay-go restrictions. Are Democrats going to do that on Medicare with this?
That's why this is so incredibly important to solve this issue. Because this is about the ACA, this is about Medicaid, this is about premium tax, the premium tax cuts and the subsidies associated with the premium tax credits. But the trigger of $500 billion to Medicare is also what's at stake. That's what Republicans have done. We're only in that place because of the big ugly law and what that has meant. The cuts that are in the law now trigger further cuts in Medicare. So, like I said, if Republicans are willing to work with us in a bipartisan way, we have solved some of these issues in the past. We will continue to work with our colleagues, reasonable colleagues, to solve these issues in the future. That's not where we are today. We are seeing partisan attacks on healthcare, and I want to defer to Ami Bera and Maxine Dexter on your first point. But what I will say is, all the happy talk and all the nice letters that our Republican colleagues sign, they're nice. I'm sure that they send them to their constituents and they tell them that they're fighting for them. We saw this with Medicaid. We saw 15, 17 Republicans sign a letter saying that they weren't going to attack Medicaid for vulnerable populations. And then they went and supported the bill. So I don't believe any of the letters that they signed. It's strictly to make them sleep better at night. I'm not concerned. My feeling is that this isn't about actual policy. This is about, them being able to defend terrible positions and saying, well, I told the speaker. Well, it's not enough to do that. You got to take action.